Welcome to the Risky Healthcare Business Podcast, where we help you prepare for the future by sharing stories, insights, and skills from expert voices in and around the United States healthcare world, with a mission to inform, educate, and help healthcare organizations and individuals ranging from one doctor practices to large integrated systems and organizations throughout the dental, medical, and veterinary healthcare industry with risk, while hopefully having some fun along the way. I'm your host, Scott Nelson, a guy that grew up in Ohio and has been working all over the United States during my 20-plus year and counting career in the healthcare industry, with a commitment to accelerating healthcare performance through creativity, not just productivity. Let's dive in. The healthcare supply chain is one of the most critical yet fragile systems supporting modern healthcare, playing a pivotal role in ensuring that medical, dental, and veterinary professionals and organizations can deliver timely, quality, and effective care. From the medications that treat patients to the surgical tools, diagnostic equipment, and supplies, the healthcare supply chain is vital to the continuity of services. In recent years, particularly during the COVID-19 pandemic, its fragility has been exposed, challenging the preparedness of the U.S. healthcare system and individual organizations. Now, after Hurricane Helene swept across parts of the country, testing supply chain resilience once again, we are reminded of the importance of being prepared for unforeseen events. The U.S. healthcare supply chain is a complex, multifaceted system that encompasses a wide range of stakeholders, including manufacturers, distributors, regulators, and healthcare providers. The supply chain's reach extends far beyond national borders, in some instances relying on global suppliers and international logistics to maintain a steady flow of healthcare products. Dental care professionals depend on equipment such as dental chairs and implants, while hospitals and medical practices require medications, diagnostic devices, and surgical tools to operate effectively. In veterinary care, specialized animal medications and equipment are essential for surgeries and other services. Each of these sectors faces similar challenges tied to the nature of supply chains, increasing the risk of disruptions. Understanding the fragility of the U.S. healthcare supply chain is key to addressing these risks. Professor David Dreyfus is an assistant professor of supply chain management at Rutgers Business School, where he teaches demand planning and fulfillment, operations analysis, and business statistics. His research focus is on healthcare operations, population health, teams, disruptions, and risk. And in a chapter, he contributed to a book, Reflections on the Pandemic, COVID and Social Crises in the Year Everything Changed. Professor Dreyfus points out how the pandemic laid bare vulnerabilities within the supply chain that had been previously overlooked, and that better and more robust supply chain management principles must be adopted. Even now, years after the onset of COVID-19, healthcare providers continue to navigate challenges posed by risk management and supply chain disruptions. Geopolitical tensions, such as trade disputes and tariffs, create bottlenecks by limiting access to crucial materials. These tensions, combined with regulatory changes and delays in approvals, complicate the production and availability of supplies and equipment. Natural disasters like hurricanes, or earthquakes, or wildfires disrupt the supply chain. The COVID-19 pandemic was a glaring example of how gaps in the availability of personal protective equipment and other supplies can severely impact care delivery. Recent events like Hurricane Helene demonstrates that while lessons may have been learned, the system remains vulnerable. The storm's impact on Baxter's North Carolina facility, a key supplier of IV fluids, is already causing concern about potential shortages and delays in care delivery for hospitals across the U.S. The risks within the healthcare supply chain are numerous and interdependent. Supplier reliability is a critical factor, as over-reliance on single-source suppliers or certain regions can create a significant bottleneck. If a single supplier faces a disruption like Baxter, the entire chain is affected. Transportation and logistics challenges compound these risks. Port closures, driver shortages, and freight delays can derail the timely delivery of essential supplies. Moreover, the lack of redundancy in sourcing, where healthcare organizations fail to establish backup suppliers, further magnifies the risk. A robust healthcare supply chain requires building redundancy to ensure that there are alternative sources of critical supplies, safeguarding organizations during crises. When the healthcare supply chain is disrupted, the consequences are far-reaching. Patient care is the first to suffer. Delays in treatments, canceled procedures, and extended hospital stays due to supply shortages can have detrimental effects on patient outcomes and satisfaction. The operational efficiency of healthcare facilities also takes a hit. as increased costs associated with sourcing scarce supplies or alternative products strain budgets. Disruptions lead to rethinking staffing, scheduling, and resource allocation, all of which challenge the ability of providers to deliver care efficiently. For medical and dental offices and veterinary clinics and hospitals, the financial stability of their operations can be jeopardized when these disruptions negatively impact revenue, drive up costs, and reduce profitability. Recent events offer clear examples of how supply chain disruptions continue to challenge the healthcare industry. In the aftermath of Hurricane Helene, Baxter, the leading manufacturer of IV fluids in the U.S., is struggling to recover from significant damage to its North Carolina facility. With shortages already emerging, healthcare providers are bracing for what could be another prolonged period of supply challenges. This situation mirrors the challenges faced during COVID-19 as healthcare systems scrambled to manage shortages in essential supplies like PPE and ventilators. The lessons from these experiences emphasize the need for preparedness and the importance of diversification and redundancy within the supply chain. Another notable example comes from the recent dockworker strike. These labor disruptions have the potential to cause bottlenecks in the supply of healthcare equipment and medications, sending ripple effects through healthcare systems across the country. As healthcare organizations grapple with the delayed shipments, it becomes clear that the healthcare supply chain is only as strong as its weakest link. These disruptions should be seen as a wake-up call for the healthcare industry, the industry sectors, and healthcare organizations to re-examine and strengthen supply chain strategies. To mitigate the risks of future supply chain disruptions, proactive risk management is essential. Healthcare organizations need to build relationships with multiple suppliers, reducing reliance on single sources and thereby spreading risk. Leveraging data and technology for real-time monitoring of the supply chain allows for quicker responses to potential disruptions. Furthermore, regular risk assessments can identify vulnerabilities in the supply chain, and contingency plans should be in place to ensure that operations can continue smoothly, even when disruptions occur. These strategies are integral to maintaining the flow of essential supplies, operations, and care delivery during a crisis. As we look ahead, it's clear that the U.S. healthcare supply chain is critical, but also fragile and must be fortified at both macro and micro levels to ensure the delivery of quality care, even in times of crisis. Building a resilient and adaptable supply chain is not only about preventing shortages, it's about ensuring that healthcare professionals across dental, medical, and veterinary sectors can continue to provide high-quality care when it matters most. Thank you for listening to the Risky Healthcare Business Podcast. You can listen to all episodes from the Resource Center page of the SpringParker website, springparker.com, or click the listen link in the show notes to listen and subscribe for free on your platform of choice. And remember, accelerating healthcare performance is achieved through creativity, not just productivity.